My next guest politely reminded me that they have actually been doing business in Canada for a number of years, unlike my assumption, which was that they were a recent entrant into the Canadian market. Well, he's going to prove me wrong, and he's going to give me an interesting take on what he's seeing in the Canadian health IT ecosystem. Hello and welcome to Healthcare IT Today, where we bring you the latest stories and interesting insights from the world of health IT. I'm Colin Hung, and I'm about to sit down with Michael Kearney from Altera Digital Health. Him and I are going to have a conversation about their company's work here in Canada, their history, and more importantly, what he's seeing that's got him excited right now in Canada. Let's get to it. Michael, welcome to the program.
Hey, it's really great to be here in British Columbia, in Canada, at eHealth.
And this is actually part of the reason why I'm excited to get together with you, Michael, because Altera Digital Health, of course, I know and love from all the work we see you guys do in the US, but you were telling me that Altera actually has been in Canada for a very long time. So can you tell our audience a little bit about that?
Yeah, we have been in Canada for over 38 years. Our core EHR product, Sunrise Clinical Manager, is actually a Canadian innovation that was developed out of Richmond, BC. So we still have quite a large footprint of developers, of QA, of support here in British Columbia. And we've got a big team here in Canada with people from across, from coast to coast, from Nova Scotia, from New Brunswick, Winnipeg, from Vancouver Island, and I'm here. I'm from Port Coquitlam here in British Columbia. So we've got a team from right across Canada here at eHealth.
And what are some of the projects that you're working on with the Canadian healthcare organizations?
Yeah, so when I'm talking about the people from across Canada, that's because we're supporting provinces and health authorities and large physician practices across the country. So we're in Service New Brunswick with our Sunrise and with our patient flow system. So Sunrise, obviously the core EHR, the CPOE and acute ambulatory care in all those EHR functions. We've got patient flow providing bed management, portering and services to facilities. We've got a mobile application for both Sunrise and for patient flow. So people are able to get their orders on the move around the hospital, get their work orders and go to whatever facility or unit and get organized. We're in Manitoba. We're very tightly integrated with the province of Manitoba and their future plans. We've got our Sunrise EHR, it's our core EHR, and we're rolling that out across the province. We've got dbMotion, our HIE CDR, bringing in all those disparate data sources from their primary care and different systems across the province. So they've got that longitudinal patient view, one view. So we're also in Saskatchewan. We've got Sunrise there and patient flow. And then out here in British Columbia, we've got our dbMotion and the Fraser Health Authority.
dbMotion, not a name I've heard a lot recently. Tell me a little bit more about the work you're doing here with dbMotion.
Yeah, well, in Manitoba, as I say, we're looking to be a provincial partner, Altera and Manitoba together partner. We've got dbMotion and Sunrise. We're pulling in data from across the province from hundreds of different downstream systems. So you're getting that single view. They're doing a lot of awesome things with dbMotion in Manitoba. Also here in Fraser, where we've got Meditech Expanse, Legacy Meditech, Paris Mental Health, their provincial lab system, and we're pulling all that data in and giving that single view to the clinician. We're implementing our agent project, so our agent, dbMotion agent. So yeah, we've got a really good in-depth customer deep relationship with our partners here with dbMotion in Canada. We have also got our iPro anesthesia information management system that we're selling across. We've got that deployed to multiple health authorities and provinces across Canada, and that's something we're looking to roll out more. That's an awesome, world-renowned anesthesia management system that we're delivering and implementing here in Canada. Yeah. So yeah, we've got a really good history here One of the things we pride ourselves with in Canada is the operational excellence and being awesome, being insanely great for our clients. So customer support, that partnership, that white glove service, we're really keyed into that, and we have a really close collaboration with our clients. Partnership is very important to us, and that's seen in the feedback that we're getting from our clients. And we want to keep developing that and delivering that, using a lot of the new tools that came in with the Harris acquisition. OE, operational excellence, is really important to them, being a little bit better every day. I'm sure you've heard when you've talked to other people at Altera, empowerment at the point of contact, which is really important. Harris value, we've got that right here in Canada. We're able to deliver for our Canadian clients. We've got our own solutions group here. We're working on the big interoperability problems that Canada faces. We're looking to integrate with the Prescribe It IT, the Canada Health Infoway initiative for electronic prescribing. That's going to be delivered through our Sunrise EHR. We're working on the e-referral, e-consult, and the PSCA, the patient summary. Sunrise has FHIR-enabled services, so we're able to allow the patient or the clinician to be able to pull that information using the FHIR technology. So yeah, it's a really exciting time here in Canada for Altera.
Michael, you shared a lot of great information with us today. Where can people go to find out more information about Altera Health?
Okay, you can reach out at, you can find us at ca.alterahealth.com, or you can look me up on LinkedIn, and or you can follow us on LinkedIn at Altera Canada. And we've got our own LinkedIn page. You can see all the wonderful things that we're doing specifically for Canada, deploying our applications, and get some user stories there and meet some of our great employees that we have working for services, solutions, and support, customer support for our clients here in Canada.
Awesome. Michael, thank you so much for being on our program. It's been great having you.
Oh, thanks so much, Colin. It was great meeting you here in my hometown, so nice to see you.
Hey, I want to thank Michael for coming on camera with me and giving me his perspective on the Canadian health IT ecosystem and his company's history in Canada. I certainly appreciated it. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareitttoday.com, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.